This is Pathway to Health with Dr. Krygier.
Hi, and welcome to Pathway to Health with Dr. Michael Krygier. I'm Randy Nunez, your host, and today we're going to talk about the liver. But before we talk about the liver, let's welcome our course special guest, Dr. Michael Krygier. Thanks for joining us again.
Thanks, Randy, for having me. I appreciate it.
So before we get to talking about the liver, why don't you tell us a little bit about your practice?
Well, my practice is called Chiropractic and Alternative Health Services, and I'm located off of Novi Road between 10 Mile and Grand River. I've been practicing in the Novi area for about 17 years. In my office, we see chiropractic patients, which is basically low back, neck pain, back pain, any issues, sports injuries, whatever it may be, as far as structural issues. And then on the alternative side, we take care of putting people on programs for different disease situations, whether it's disease for recovery or if it's help support or integrate a treatment they're already doing. A lot of that is involved with diabetes, heart disease, cancer, whatever it may be. So I have a very extensive background in alternative health. I have an herbal degree as well as a nutritional degree. So I like to use those in my practice and use my knowledge to help people.
Okay, very good. So let's talk a little about the liver. There seems to be an epidemic of diseases around the liver. But before we do that, what does the liver do? What functions does it perform?
Well, the liver's the second largest organ in the body to the skin. The liver is actually the largest gland inside the body. It actually holds 10% of our blood supply at one time. So in knowing that, it's very important in filtration and making sure that anything we come in contact with our environment, whether we touch, breathe, eat, it has to be detoxified by the liver, and the liver's job is to do that. Another function of the liver is to storage for sugars. A lot of times, the liver, when the blood sugar drops, the liver has to go into an effect and raise that blood sugar by releasing stores of sugars from the muscles or from the liver itself. It does have a little bit of storage there. Another thing the liver does is it helps us with bile or fat absorption, which is very important in Michigan because we have 4 seasons. And having fat-soluble vitamins, and on the contrary, medicine telling us we shouldn't eat a lot of fat, we shouldn't, eat saturated fat. It's very difficult to get those fat-soluble vitamins, and that's what our immune system runs on. So it's tough in a fall or winter season to fight infection when you don't have those good fatty acids and the good fat-soluble vitamins. So the liver is very important in storing those fat-soluble vitamins as well as iron and copper and other minerals.
Wow, so the liver is a pretty important organ, you would
Yes.
say. So what are some of the common diseases or problems that people have with their liver?
First of all, the liver, a lot of people don't know they have a problem with the liver. One of the things is liver conditions are very compensatory, meaning they're silent like blood pressure or diabetes. They're silent killers. You don't realize that until they're in their advanced stages. They know that a third of all a liver disease such as cirrhosis of the liver, a third of all those people that have cirrhosis don't even know they have cirrhosis until they're in their advanced stages.
Really?
So it's a very it's a very sneaky it's a very sneaky situation to know when you have a problem, when you don't have a problem. So one of the things out of our office we do a lot of testing for that. I know a lot of the signs and symptoms that I'll talk about in a little bit, but the main thing is finding out if you have a liver issue, and there's usually 4 stages to liver problems. The first stage, obviously you have a normal liver, it's functioning correctly. Second stage is usually you have some type of fatty infiltration. And that fatty infiltration is becoming an epidemic where fat is deposited into the liver and it affects different functions. It could change hormone function, it can change hormone detoxification, it can create stones in the gallbladder, which is attached to the liver. All these things can influence how the liver affects you. But right now, 25% of the population is known to have a fatty liver, that first stage of disease. The second stage of disease is when you go from a fatty liver, you go to a fibrosed liver, or you get fibrin deposition where the liver's trying to heal up and it lays down collagen. And that collagen, those liver cells try to clean that up. And under certain influences, behaviors, and risks, it's very hard to stop. And then you create more fibrin and more fibrosing actually in the liver. Eventually, the last stage of liver disease is cirrhosis, where it goes from fibrin to cirrhosing, where you get an actual hardening of the liver because of all the damage that's been done and the body's inability to heal itself because of the issues.
Okay. Well, you talked about these different phases of liver problems. Is there a certain pain pattern involved that might be occurring that people don't realize it's a liver problem?
Yeah, see, I come from a chiropractic standpoint where we know that every level of the spine has nerves that come off that feed to different organs, tissues, and glands. And one of the main areas of liver problems is, the most common problem is low neck, high shoulder pain, right between where your neck and your shoulder meet, and real low between your right below your rib cage area. Those two areas are very common for liver problems, as well as pain on the right side or pain behind the eyes can tell you where you think you have headaches. You're not sick, you don't have a fever, but maybe you went to Buffalo Wild Wings or you went to Kentucky Fried Chicken, maybe you ate too much fat, maybe you ate too many spicy foods, and now you have a dull ache behind the eyes. That's related to gallbladder, and most people will be like, well, I don't know what that's from. But the liver responds usually behind the eyes, around the rib area, around the right side of the rib area, they call it that coastal area, and they also between the shoulder blades and the low part of the rib cage.
So you really need a professional to sort of help you through where these aches and pains are exposing symptoms, but that might not be where the problem area is.
Absolutely. I mean, in our office, sometimes a chiropractic adjustment will help that, will help influence the nerve and keep the processing going, because nerves control blood vessels and the venous system and the lymph system. So sometimes an adjustment's wonderful for that, but a lot of times maybe it's not a chiropractic issue. Maybe it's an issue from the liver going back up through the spine, creating a problem instead of the nerve coming out of the spine going to the liver. So maybe it's, you can walk in the door, but you can also walk back out into the door. So, there's an exit and there's an entrance. This would be on the side of the liver where the liver is creating the musculoskeletal pain, and not the joint itself being misaligned that's interfering with the organ or the gland.
I see.
So we try to determine and discern which case it is and where you're having your pain. And I've been doing it for a while, and it's simple to me, but it's very difficult. Liver function and diagnosing a liver issue and having liver symptoms are totally overlooked out there. So a lot of people don't know what to look for.
Yeah, I can understand that. I wouldn't think of pain behind my eyes as being caused by liver dysfunction.
Right.
Or you're talking about there's a cause and effect here. Is something causing this pain that's affecting my liver, or is the liver itself causing this pain that's affecting some other part of my body?
Absolutely.
Wow.
Yep.
Now, are there foods? You mentioned some foods that people might eat. Are there certain foods that can contribute to liver issues?
Well, the best thing is the liver is basically purifies and detoxifies everything that I mentioned from everything you eat, touch, smell, whatever comes into the body. The liver is responsible for that. So there's a lot of food. That liver being detoxified has certain pathways, and those pathways are all supported by nutrition. So if you're not getting your nutrition, you're not focusing on the right vitamins, the right minerals, the right herbals, you're not going to be efficient in those pathways in a toxic society as ours is, with herbicides, pesticides, medicine, even medical Medications are toxic to the liver because they have to try to get it around the liver so it stays actually in the tissue. So they got to bypass the liver so it doesn't break it down. They call that half-lives. So pharmacology is kind of in cahoots with, their medicine, but you got to understand they got to escape the liver because the liver's fighting against them.
So I've heard about, for example, some cases where someone is drinking alcohol and they might take certain medications and they're blowing some ridiculous numbers in terms of their blood alcohol content. Is that what you're talking about when you're explaining that some of these medicines need to quote unquote bypass the liver?
Absolutely.
And how can you have these exorbitant blood alcohol percentages going on?
Right. Well, we know in society there's a bell curve. In pharmacology, there's a bell curve. There's one there in the middle. Everybody responds pretty much the same, but there's people on the outside of that curve that don't respond on both sides of that curve. So some people are fast metabolizers, other people are slow metabolizers. So that's how one person could take one drink and be inebriated, and somebody else needs 4 or 5 drinks and be inebriated. That could come from a issue with acetaldehyde where zinc is important for breaking down that acetaldehyde, and a lot of people that are drinkers are zinc deficient. So that pathway is being locked up per se, and your body's not being able to detoxify that, and that will give you more symptoms of drunkenness, stupor, imbalance, all those things.
So what are some foods they're bad for the liver?
Well, there's a lot of counterfeit foods out there, but basically excessively fried fatty foods. Counterfeit foods, I say, are basically your breads, your pastas, your pizzas, your cookies, your candies, your cake, your pastries. Most of those are high in fat, high in carbohydrate. And it's funny because when the liver's having trouble, those are the very things that you crave. Because the body can't process it, so it thinks it's not getting enough, so you crave it even more. But those issues are basically nutritional issues that we can address in the office.
So it's the typical bad foods that you think of traditionally.
It's the typical bad foods and the additional food additives. And like I say, you don't want to eat anything that's bagged, packaged, wrapped, or boxed. All those things have additives in them, and your liver has to work harder. And if you're nutritionally depleted, you're going to respond to that by maybe an allergy, maybe a dizzy reaction, maybe a little bit, I feel a little fuzzy today, and seeing. So there's a lot of symptoms that can go in that you don't realize that is a detoxification of the liver problem.
So that leaves out 90% of the foods that everybody eats. So.
Well, that's why this is an epidemic now in liver disease because we have people, drinking high fructose corn syrup. That's a big influence on non-alcoholic fatty liver, which is basically you don't drink alcohol, but you're a 9 or 10-year-old child and you have gynecomastia or excess boobs, you have weight gain. All that is because of liver function. When the liver doesn't function correctly, you can't metabolize hormones. That means that when kids develop, especially boys, they grow, they call them man boobs or gynecomastia. They also create a tire around their belly that shows that their liver is not functioning correctly. That could be because of too many soda pops, because high fructose corn syrup. They could be eating any, other corn products. There's a lot of them out there. Another reason you would know that there's a liver issue is when a lot of people are becoming wheat intolerant. Mm-hmm. Wheat intolerance is a problem in itself, but it's telling us that the liver is not accepting it. So it's telling us that the liver is possibly fatty, inflamed, and it needs additional help. So any allergies you have, what do you do when it comes spring? Everything's blooming. You go into maybe your medical doctor. They give you something to suppress the liver so that you can suppress your allergies so that the liver doesn't overreact. And then you kind of ride that for about a month or two, and then you see what else happens. So The liver overreacting it's an early sign to tell you have a problem and it needs to be addressed.
Okay. So we talked about some bad foods. Can you give us some good foods that we should eat for our liver?
The best good foods for the liver are all your sulfur foods or your cruciferous foods. That would be your cabbage, that would be your Brussels sprouts, that would be your kale, that would be your broccoli.
Onions?
Onions are in there, turnips. Those are all your good foods. Basically, vegetables and protein are very supportive of the liver. High fat, trans fat, which is artificial fats from margarines and Fabio butter, to high carbohydrates, not necessarily just sugar itself, but high fructose corn syrup with additional sugar is basically a problem.
Okay. But there are some good oils, I guess, like olive oil and things like that are probably good.
Yeah, well, the problem is a lot of our oils are being replaced, in our diet. So we don't get as much fish oil because, they only tell you to eat, 1 or 2 portions of fish a week because of the toxicity of heavy metals that the liver has to handle too. Oils are very important. Oils make sure that bile is produced correctly in the liver and stored in the gallbladder. If it's not, you'll end up with cholesterol stones. And you'll have a gallbladder stones. Oil is very important for your immune system. It's important to keep the blood slick, keep things lubricated. If you don't have oils, you can't stimulate the gallbladder. The gallbladder is responsible for releasing bile. Bile is responsible for lubricating 30 feet of intestine so that we can make sure the food's moving and it doesn't dry out and create irritable bowel, ulcerative colitis, all those issues. Protect the lining even from food poisonings. So that bile is very important, and it's a major issue because a lot of us have possibly thick bile because bad foods, certain medications, abnormal hormones like estrogen, birth control pills, all those mess, especially anything synthetic that the liver doesn't recognize, has to go in overdrive to handle it.
Okay, so we talked about some good foods and some bad foods. What else can we do to help overcome these liver problems?
Well, the first is going through your diet and picking out those foods that are not going to be beneficial. Whether it's alcohol, whether it's beer, whether it's wine. First of all is analyzing your diet. Do a good diet survey and find out. Let's be honest and get down to the point. Let's not beat around the bush. The next thing is find out what stage the liver issue is in. If you have the first stage, actually let me rephrase that. If you have any of the stages, I always recommend a purification program. There's a purification program I already have set up, but it's the least you can do for your health, and you don't have to worry about, do I have a problem with my liver? Most of the time, that'll take care of it.
So let's talk a little bit about that. What exactly is this purification process?
Purification is basically vitamins, minerals, herbals, all those things that Standard Process has put together that will help to detoxify the liver, that will help clean out the biliary system, that will help thin the bile, that will help move things through the intestine, that will help cleanse the kidneys. So you're really doing the whole digestive tract, and it's a very extensive process. And I'll show you at the end where you can go to get that information and where you can order that.
So it's not only the supplements, it's also, how long does this take, and do you have to change your diet?
Well, the purification program is 21 days.
Okay.
So you have to there's a book, there's a toxicity questionnaire to see where you're at, to gauge where your health is. And then from there, you do the 21-day. I usually recommend every year somebody doing the 21-day cleanse just to make sure everything's taken care of, cleaned, whatever we're exposed to. It's just good common sense.
And is this, do I have to change my diet at all? Do I change other behaviors?
For 21 days, it's very rigid. There is some leniency. There's a mild, moderate, or severe levels that you can do.
So there's tiers of
Sure.
how deep do I want to ensconce myself?
Right.
in
You
this?
might if you got a lot of the your toxicity questionnaire is pretty high, you might want to do the mild first and then wait and then maybe do something additional maybe 3 or 4 months later. But you can gauge that just on your toxicity questionnaire, what type of medications you've been on. Have you been on a lot of pain medications, especially Tylenol that's very adverse to the liver? You know, what type of disease? Do you have diabetes? Do you have cancer? Do you have heart disease? All those things benefit by detoxifying and purifying the liver and the biliary system.
So is this something I can do on my own, or should I work with a healthcare practitioner like
Well, to get extra information in that, you know, a consult would be a good idea, but if you just want to partake and you are very knowledgeable, a lot of people are knowledgeable because the internet has a vast amount of research. People like to go on themselves. So if they would just like to order the product and read the information, it's all available on my site, and it's very easy to understand.
Okay. And so what other kind of things can we do to help with liver problems?
Well, the first thing is to, you know, get a head start, do the purification problem, find out a survey or an assessment of what you're eating, find out how many drinks you're drinking a week, find out what medications you're taking, look at the foods you're eating, whether they're in the cruciferous family or they're, you know, or maybe they're in the potato family with a high carbohydrate, high starch. So, you know, going through and detailing that. The next thing is to try to find out where you are in your stages. Maybe you're just at the non-alcoholic fatty liver, or maybe you have a fatty liver. If you start to have fibrosing, you might want to do an additional supplement program to help support the fibrosing issue. And you can actually slow that down or even stop that and reverse a lot of these issues now. They did a study recently on a certain protein that was put together by a company, and I will put the slide in the show of the article. But basically, they found that feeding mice or rats whatever they're experimenting on, they actually reversed fibrosing and even cirrhosis of the liver just by targeting a certain pathway, and that pathway can be influenced by a bunch of different nutritional and safe, non-toxic therapies.
So how do I know where I'm at in those stages? How do I know what my liver stage is? If you will?
Well, a lot of times what you want to do is, the best way to tell if you have a fatty liver is to do an ultrasound on your abdomen, find out if you're, another way is to look at the signs and symptoms.
Because you said the signs and symptoms are a bit tricky, because I could have a headache. It's my liver.
Right, but there are some progressive signs and symptoms that you can look at, like angioedema, or you get a red prick on the skin throughout the body. That tells me that the liver is not producing platelets, and those platelets are causing little ruptures or creating little petechiae in the surface of the skin. That's an indication that the liver is having a problem. Another indication is a lot of men walk around with pot bellies. They say that's beer bellies, but it is, you know, the liver having trouble handling, because what's going on is the body's not getting enough protein. It's not producing enough a product called albumin, and it's not regulating that fluid. And what happens is that fluid leaks into the abdomen, and you can push your stomach side to side, and it will feel like a water balloon.
Really? So you can look at two people and just tell someone who's got real fat and someone who maybe doesn't.
I can pick them out of the crowd.
Okay.
Another symptom that I would, besides the pain pattern that we talked about, another symptom might be clubbing of the nails, squaring of the nails, which is another issue, or they get brown patches on the back of the hands or the skin. And that's a direct relationship to the oxidation in the liver.
Is that different from age spots that people get when they get older?
Those are all liver, and those have to do with different nutritional inadequacies. And the biochemistry is very supportive of that.
So they call them liver spots for a reason.
They could be, liver spots.
But when you're younger and you get liver spots...
That means you're accelerating, your liver is deteriorating a little bit quicker.
Okay. So we talked about some of the signs. We talked about the chronic conditions today around the liver and how we can maybe get it healthy. But can you give us some more information around where people can get conditions involving the liver, and you talked about this detoxification kit. Now, where can people go to get more information?
Well, I have a website that has a lot of this information on there, and all the information that's actually in that we talked about today is actually going to be on PDF and slides, so that people can actually go to the web page. They can either watch the video, on cable network, or they can actually just go and look at the PDFs. They don't want to, sit and listen. Some people just like to read.
All right. So, what's your website?
My website is www.drkrygier.com. No period between doctor and Krygier.
DRKRYGIER. Okay. And any other reference sites that you'd like to?
There is a book called The 7 Principles of Fat Loss that I would highly recommend.
Okay.
The doctor is a chiropractor. He did an excellent job of breaking down liver function, adrenal function, thyroid function. It's a little bit off topic, but basically it's the endocrine system and why we have such an obesity problem and a liver problem and a nutrition problem. So that book is called The 7 Principles of Fat Loss, and it's by Dr. Eric Berg.
Okay. Well, I think we're all interested in weight loss, and especially if it talks about your liver health. I think that's a good thing as well. Any other kind of resources that you'd recommend? What would I get if I went to an office visit and I suspect I have a liver problem? What would you do?
Well, as soon as if you ever, I know you've been to my office, but if you ever walk into my office and you look to the left from the first room, I have the liver detoxification pathway, the symptoms, the whole endocrine system, the symptoms. So you can just go and walk in and learn, right? You just look at my board. I got it all sketched out for
the wall of the liver.
Yes.
Okay. That's
because
good.
I mean, people need to see that. In these day and age, scientific research is very available. Good. There's a lot of good truth out there. I don't think anybody's applying it, and I just took it, put it on the wall, let people see what it is, and it's a simple concept that you can change your health with.
Well, there's a lot of what I like to call data on the internet, and sifting through what's good information and not can be troublesome. So it's good that people like you, professionals like you, can help guide us in some of those areas and what you consider good resources.
I agree, and I only provide whether it's supplementation, whether it's information, whatever it is. I try to be the highest level I can get it at, and the most reputable companies and the best I can give it. I'm not into just peddling something. I want to make sure it's the best quality. It's designed for what I say it's designed for, because I got to back up my words too, and I don't think a lot of doctors put their money where their mouth is.
Great. Well, I think we're about out of time. I'd like to thank Dr. Michael Krygier for sharing all his information about the liver, how we can keep it healthy. Stay tuned again for upcoming shows on Pathway to Health with Dr. Krygier.